back to our next session. Our next speaker is Pam Talbot, and her presentation is From Spreadsheets to Data Visualization and Storytelling, Tools to Effectively Communicate IPAC Data. Pam Talbot is currently an epidemiologist with Nova Scotia Health, Infection Prevention and Control. She completed her master's in epidemiology at Dalhousie University, and after 17 years with the Diabetes Care Program, made the move from chronic to infectious disease in August of last year. Pam is a true data geek. Her words, not mine, and has a passion for making data accessible to many audiences, from frontline staff to senior leaders and decision makers. Data visualization and data storytelling combine her love of numbers with her creative flair. Outside of work, Pam is an avid quilter. So Pam, I will hand this over to you. And just like other sessions, you can add questions into the Zoom chat. And Pam has a couple of areas in her presentation where she will ask specifically for interaction. And that can be if you want to unmute yourself or use the Zoom chat, that would be fine. Whatever works for you guys. Thank you, Pam. Oh, and you're muted. Let's see your mute sign.
Oh, sorry. Yeah, thank you. I'm just going to turn off my video while I present just because I find that distracting, and I will then get underway. So I am happy to be presenting today, and hopefully the content is going to be helpful in your day-to-day work, especially in trying to convey important messages around infection prevention and control to various audiences. So before I get going, I'm just going to channel my inner DeForest Kelly for a moment and preface today's presentation by saying I'm an epidemiologist, not a clinician. So most of my professional life, as Angela mentioned, has been spent in diabetes and primary care. I know a lot about epidemiological principles and methods from that work, and these skills are very transferable into the IPAC world. But I rely on IPAC clinical experts to provide the necessary content for interpreting surveillance data through the lens of infection prevention and control. So let's just start with some basics. So John Snow is considered one of the fathers of modern epidemiology, which is essentially the branch of science where we examine patterns in health-related data with the goal of understanding the underlying causes of health in general and healthcare outcomes. And we strive to use that knowledge to help improve health and health outcomes in the population. So John Snow is also famous for a data visualization. In 1854, there was a severe cholera outbreak in Soho, London, that resulted in more than 600 deaths. And John Snow, a local physician there, was skeptical about the prevailing theory that cholera was caused by bad air, which is known as the miasma theory. He took to the streets and he collected information from affected households to look at patterns that might provide a clue as to the source, and he plotted the locations of households affected. And a pattern did indeed emerge. So this now famous map shows that the Soho cases really clustered around the Broad Street water pump. And this map was enough to convince local authorities to remove the handle from the pump. And after that, the cases went down. And although it was eventually replaced, and it would be more than a decade before Snow's theory of cholera being waterborne gained traction, this was an important epidemiological event. So I particularly love this illustration for a few reasons. One, my sweetie is a cartographer, so I have a love for maps, and it demonstrates both the surveillance cycle and the effectiveness of great data visualization. So as demonstrated by Snow, surveillance is the essential tool of epidemiological practice. So I'm partial to John Last's definition because it includes the term collation. And this is the step of arranging data into some kind of standard and logical order. And this is also the step that is really the most labor intensive. And by the time you get to the analysis phase, probably 80 to 90% of the work is done. And also, similar to that definition for epidemiology, there's a big and here. And that's because surveillance doesn't end when the analysis is complete. Analysis must be shared with content experts to be turned into useful information. And then it needs to be shared with the folks who can take action on that information if action's required. And really, action is not the end of the process either. Surveillance is really a cycle. So once the action is carried out or not, whatever the case may be, more data are collected, they're collated, they're analyzed, they're interpreted, they're disseminated, and they're acted on, and that goes on and on. So today we're really going to focus on the first 5 steps of the cycle, from data collection to the dissemination of results. So in addition to surveillance being an essential tool for epidemiology, IPAC surveillance is actually a legal requirement under the Patient Safety Act, with the Department of Health and Wellness making select indicators available on their public-facing website. And IPAC surveillance is also a required organizational practice under Accreditation Canada. So before we move to surveillance tools, just want to pause here to see if there's any questions about epidemiology or surveillance in general.
Nothing in the chat so far, Pam.
Okay, very good. So we'll move on to surveillance tools. So the illustration at the beginning of the presentation highlighted the importance of surveillance in infection prevention and control. And fortunately, we have many more tools at our disposal than John Snow did. So today we're going to look at a very common and powerful tool, but first just want to look at some considerations when you're evaluating surveillance tools in general. So the first step in the cycle, as we noted, is collecting data. And I'm sure everybody here has heard the adage, garbage in, garbage out. So we want to make sure that the data that we collect are complete and as accurate as possible. And we also want to balance that with the timeliness of the data and the burden on the folks who are actually entering it. So I was reading a recent article in the American Journal of Infection Control, and the authors noted that ICPs spend an estimated 40% of their time on surveillance exercises and activities. So a good surveillance tool is going to make that work more efficient. And once the data are collected, it's also important to be able to get them back out of whatever tool it is that's been used to collect it. So back in the early days when electronic medical records first came out, one of the difficulties that folks had is that they had a really difficult time getting the data back out. These records had a lot of free text fields. They were individually configured systems to specific practices. And what that ended up meaning is that it was very difficult to pool the data across practices and look at any kind of population-based trends. So being able to easily extract the data in a standardized and comparable format is key to turning the data into useful information that can be used by ICP professionals and by leadership. So with these considerations in mind, we're going to look at some examples using an Excel tool. And Excel is really great. I'm a huge fan of it because it's familiar. It's part of the Microsoft Office suite, and most organizations have access to it. So Excel was initially launched in 1985 on Apple devices. And in the very early days, it was quite limited. It had a finite capacity of about 16,000 rows, which sounds like a lot, but in sort of healthcare data, it's pretty limited. But now the newest version of Excel can handle over 1 million rows and 16,000 columns. So it's a very robust system for handling large data sets. And it can also be used across the surveillance cycle. So it can be used to collect information, to collate it, to analyze it, and then to help create data visualizations for dissemination. So in the next few slides, I'm going to use some illustrative examples from the IPAC long-term care surveillance tool, which is really quite fantastic. So this is just a snapshot of one of the line lists. And as I say, this was created in Excel, and it actually has a number of automated features for reporting, but there are still areas where it can be customized to make data entry more efficient and accurate. So one of the examples of this is the area where you enter your facility's name. So currently it's a free text field, but you can customize that cell by using the data validation tool in Excel and a reference list that you type into another tab with the list of all the facility names in your organizations. And then it appears as a drop-down menu when you click on that cell. And drop-down menus are an epidemiologist's best friend. I'm sure it doesn't take a lot of imagination for folks to appreciate how facilities like ones in Musquodoboit might get spelled incorrectly. Or even common things like harbor view. Some people use the O and some U, and some people just use the O. So, and each of those spellings looks like a different facility to the software. So another customization you can do, you can use formulas to reference information that's previously been entered. So this will automatically populate any number of cells that get repeated across sheets. So in looking at this tool, another way to customize it would be to add your facility name to the top of the reporting tables and the reporting graphs. And this is really easy to do just by putting in a cell reference back to the facility name cell that we just looked at in the drop-down menu. So you just put a formula in C2, the cell where it says Elm Lodge right now, and that references the infection tab and pulls the information that was entered over there into your sheet. So it just automatically appears there, and you can build this kind of automation throughout your sheets. Excel also allows you to convert a basic spreadsheet. So kind of when you first enter Excel and you've got that blank grid into what's called a data table. And a data table has a few advantages, especially when you're continuously adding data to it. So the IPAC tool has the line list structured as a data table. One thing that happens with data tables is you get shading in your table, and those shaded rows help you when you're scrolling across that wide sheet. And then the other thing is you'll notice all those little triangles at the top, and those allow you to filter down on any of the columns that are in your data sheet so that you can restrict information if you want to. So for example, you might only want to look at the rows that have COVID cases. So you can just click on the little triangle under COVID and it'll bring up a menu, and then you click on the X's because that's how you use the sheet to indicate that there's a COVID case. And then presto magic, all the other cases went away and all you're seeing is the COVID cases. And you can add more filters. Like you can imagine if this is a very large facility and it's in the middle of respiratory season, you might have many, many lines, and you might want to filter by a particular unit, or you might want to look at activity in a particular month. So you can layer filters. And the other great thing about data tables is they make it very easy to create and update pivot tables and charts. And this can be a real time saver if you have lots of them. So in my previous life, I actually inherited a project that had dozens of pivot tables and they were connected to multiple slicers. And every time I updated the data, I disconnected the slicers, updated the data range in the tables, and then reconnected the slicers. And this actually took a couple of hours every time I did an update. And then I learned about data tables, and that was no longer necessary. There's a refresh button, and you literally press refresh, and everything gets automatically updated across your entire Excel workbook. And the other nice thing about slicers are that they allow you to interact with your summary tables in the same way that you could filter the data sheet that we just looked at. You can filter these summary tables. So again, you've got this graph here, but maybe you're only interested in what's happening on unit EL1. So you can just click on that button and presto magic again, everything adjusts and you're just looking at the counts for that in the tabular format or in the graph. So this is a really great way to explore data, especially when you've got lots of data to look at. So another resource that's critical in every step in the surveillance cycle is not software or technology at all. It's the people. And it's the role of subject matter experts, and that really can't be overstated. So, sort of going back to that adage about garbage in, garbage out, the successfulness of any IPAC surveillance strategy is guided by the diverse experts and their experience. So, you can have the best technology, but your data or your data interpretation can still be unreliable if anywhere along that surveillance cycle it gets compromised. So a mentor of mine used to use the term context-free analysis, and that was to refer to situations where data are interpreted by folks who don't understand the larger context. So in the case of IPAC, context could be a change in a case definition. It gets more stringent or it loosens over time. Or it could be that a lab test is now more sensitive, so you're finding more cases of a particular pathogen. And it can also be about the nature of the population that's under surveillance. So if you're looking at infection rates in a day surgery unit, that's going to be very different than looking at infection rates on a burn unit or an oncology unit, and it wouldn't really be appropriate to compare those groups because one is so much more susceptible to infection than the other. So the subject matter experts are the people that can provide the insights to optimize your surveillance at all those points along the cycle. So with data collection, it can benefit from people who are experts in survey design to make sure that the questions in a form are well articulated and that they flow in a conceptually good pattern to aid with data entry. But it also benefits from the people that are on the front line that understand the IPAC workflow. So if a surveillance tool doesn't fit with the flow and it's hard to use, it's going to affect how good the data are. At the collation and analysis phase, it can benefit from experts in epidemiology and stats, but it also benefits from clinical experts who understand how to categorize things. So we want to make sure we're comparing apples to apples and oranges to oranges and not comparing things that we shouldn't be. And then at the data interpretation stage, diverse experience can help to contextualize that information. And ideally, that's what makes data into useful information. And here, it's also important to have an appreciation for the audience. So a senior leader is going to have very different information requirements than a manager or a charge nurse or somebody in the general public. So good data visualization and good surveillance techniques gets the right information into the right hands so that meaningful action can take place. So before we move on to the data visualization part and the storytelling, just want to pause here to see if there's any questions about the Excel example or surveillance tools in general.
No questions in the chat yet, Pam, but
Okay.
I have a question. Um, for those people who do not have access to a fabulous epidemiologist like yourself, do you have any recommendations for learning Excel, excelling at Excel, preventing the garbage in, garbage out, resources that people could go to? Maybe that would be
There
something. Sorry, go ahead.
there are some really excellent resources online. YouTube videos abound. There's one, and forgive the name. It could be a bit triggering for folks, but it's called Trump Excel, and it's I think it's a 12 or 14 series introduction to advanced Excel use, and it is really fantastic. It covers the basics. It talks about how do you use formulas, how do you take information from a data sheet and turn it into pivot tables. um, how can you create a dashboard, like for the really tech savvy folks, like you can add layers into the sheet. So that is probably one of my favorite go-tos, but often you can just, if you have a specific question, you can just Google and you will get YouTube videos coming up.
Perfect. Thank you. And Michelle says, I've been sucked into some Facebook reels learning about how to optimize Excel. And I do have a friend who is a teacher who tells me there's an entire Excel TikTok world that I have not got into, but I guess there are resources everywhere. But yeah, YouTube, if you need it, YouTube it. Somebody else says, yes, the Excel rabbit hole is real. Perfect. Thank you so much. If anybody else pops in, I'll let you know, Pam.
Yeah, okay, excellent. Yeah, and like say, like Excel is fantastic, and part of the fact that it is so common in use means that there's a huge user community, so you can usually find lots of information. And there's even things as simple like, I've been using Excel all of my professional life, so I forget that I'm using it at a level that some folks are unfamiliar with. And things like freeze panes is a great example. Like if you've got a long line list that you want to scroll through, instead of using your wheel and scrolling down, you can hit freeze panes and you can scroll and keep it there. And then you can see all the headings at the top of your line list. Or in the data table version, it will keep the headings at the top of your screen, but it grays them out when you're not in those top rows. So there's a couple of strategies around being able to see the heading of your line list when you're at like the 100th entry. Hopefully no one is ever at that unless they're collecting it for a whole year.
We have a few comments. Christine says, truthfully, still find Excel mystifying. I appreciate those who are proficient, such as yourself. And then we have a question from the Feedloop chat. Drop-down menus help reduce the data cleaning you need to do later. I use Excel all the time in Ontario, working in long-term care, downloading resident immunization status from the EMR to ensure we have consents in place before administering a vaccine. Interesting. Often you will need to do some data cleaning to create a usable database. What are your thoughts about data cleaning?
So part of the reason I'm such a fan of those drop down menus is really just as the commenter said, it really helps with the data cleaning step, to make sure that a facility name is always spelled the same way. A unit is always referred to. One of my favorites is there's the Nova Scotia Health D.21 for Dartmouth General Unit 2-1, but sometimes I also get like Dartmouth 3 East and Dartmouth 3 West or 3W, or so all those variations. So a drop down menu just sort of makes sure that you're getting consistent information. The other part is you can create formulas to do some data validation. So, for example, you can, if you've entered date of birth, you could look at like min maxes, like to make sure that you haven't got somebody born in 1895. Or you can look at, if you're looking about infections that have to happen within a certain time frame of an admission, You can put your admission date, and then you can have your infection date. You can do a formula to calculate the day's difference. And then you can use what's called conditional formatting on that calculation, and it can color code if something is incorrect or outside of what's expected. So if you have to have at least 3 days in a facility before something is considered hospital acquired, you could flag all the 1 and 2 days, and then you'll so those things are really helpful for looking at a huge data sheet without having to look cell by cell and entry by entry. Formulas are hugely helpful.
Perfect. Thank you. That is all the questions for now.
Okay, great. So we will now move on to data visualization and storytelling. So before I start, I just want to acknowledge that the material that I'm going to be sharing here is a sampling of knowledge that I've gained through an organization called Evergreen Data. The web address is there. There are a lot of public facing free resources in the blog with this website. Literally hundreds of articles and searchable. So if you're looking for bar graphs, or you're looking for line graphs, or you want advice about color or font, you can just sort of type in those keywords and you'll get tons and tons of information, and it's very accessible. And Stephanie Evergreen is very funny, so it's like very engaging content. It's not a dry video by any stretch. So data visualization is an art and a science. So on the artistic side, there's a degree of subjectivity that's involved. And as such, I just want to highlight the fact that sometimes, just as in life, we make questionable decisions. So for some of us, the decisions are made for us, like my bangs when my mom cut my hair. Or like the preset color palette that's in Excel or PowerPoint. Other questionable decisions we make ourselves, like the birthday outfit. So it's hard to tell from the picture, but the shirt has cowboys, mountains, and trees. My aunt gave that to me for Christmas. And the pants really look like a tablecloth. So all kidding aside, though, data visualization is subjective, and our tastes do change over time. So I'm going to share some questionable data viz that I created in my past life, and I'm going to show you how to improve it based on some of the science of data viz. So it's really important to understand how people process information, including information. And to do that, we need to draw on a little bit of psychology. So our visual system is a product of our evolution, and we tend to remember pictures better than words. And that's called the pictorial superiority effect. And we also notice patterns, or more importantly, we notice deviations from patterns. So these little bunnies are trying to make themselves look like their background, and they are really hoping that their predators do not notice the deviations from the patterns. And we're also limited a bit by the limits of our working memory. So it was originally thought that we could hold 7 pieces of information plus or minus 2. And that was a bit of the logic behind postal codes and phone numbers. A more realistic understanding is that we can hold 3 to 5 pieces of information under ideal circumstances. And in your office, when the phone is ringing and somebody is knocking at your door, it's really more realistic that we can hold 1 or 2 pieces of information. So there's a process called chunking that helps ease the load. And it's really hard to remember a 10-digit number. But if you break the number down into smaller chunks, it's easier to remember. And then if you're in the right age category and you add a little Stomp and Tom to that number, you get a really recognizable jingle, which is 800-565-7421. And there is a YouTube video for that if you want to hear the whole song. So great data visualization chunks data, and it helps to ease the cognitive burden on the audience. So tabular data are great, but, and this is my opinion, they, for the most part, belong in an appendix. So this is a table from a report that I prepared about a decade ago on lower extremity amputations. So tabular format, all the information is there. You can see that the numbers for the folks with diabetes are higher than the folks without, but it's really hard to see the differences within those groups. So when you put those same counts into a graph, you can really easily see the patterns. So the number of LEA admissions for people with diabetes is much higher than folks without. And for the folks with diabetes, it's higher in the latter years than the earlier years. And the reverse is true for the folks without diabetes. So we're going to look at this graph a few more times. Another thing to keep in mind is that when people look at data visualizations, they spend most of their time reading text, especially the title. So the image here is a heat map of people's eye gaze when they're reading a graph. So you can see that there's a lot of heat on the title, and anywhere graph or text appears on the graph, there's also a lot of heat there. So a great data visualization is going to capitalize on this, using a great title that's a full sentence and conveys your most important takeaway message. So if we come back to that lower extremity amputation chart, this time you're seeing it in the context of the presentation slide deck. So the title draws attention to the fact that there's a gap in lower extremity amputation admissions between those with and without diabetes, and that gap is increasing over time. You can use subtitles to define an indicator, as I did in this case, but you could also use it to expand on a main point if there was something else that you wanted to draw attention to, or you can make a secondary point. It really depends on the context, how you want to use the text on your graph. And we're going to visit this one more time after we discuss how the brain processes graphical information. So when we look at graphs, we're actually doing a number of perceptual tasks. Some of these tasks are very easy and some of them are hard. So the easiest tasks are those boxes at the bottom, or at the top, sorry, and they require us to judge position or length. The more difficult tasks are the ones at the bottom, and they're asking us to judge volume and curvature. And I don't know if folks online remember the craze in the 3D graph. It was a thing when Excel developed the ability to make a 3D graph, and they were really popular. I saw them everywhere, and they're incredibly difficult to read. Even looking at that volume box in the bottom, you can tell that one box is smaller than the other, but all that extra 3D effect really obscures the degree to which that small box is smaller than the larger box. And curvature is the same. And I'll show you a graph that is almost embarrassing at this point, but it really illustrates the point that curvature is really hard to interpret in the context of a graph. But first, I just want to sort of bring us back for the last time to that chart and present it as a dot graph. So you'll remember that column and bar charts were sort of the second item on that list on the previous slide, but dot charts were at the top. So here is the same information presented in two formats. And just be curious for folks in the audience, is there a preference over one over the other? And there's no right answer here.
We've got one for I like bars. Bars, bars. Somebody likes the dot. Preference over dots. I like the bar graph. Bar, bar, bar. Bar. I think bar is the winner. I actually like the dot one myself. Visually, it's very pleasing. But everybody else is saying bar. We've got tons of responses for bar.
Excellent.
Oh, and one more for dots.
Okay. Well, I will admit I'm in the dot club as well because I prefer the negative space. Like I find the color saturation of the bars a lot. But I know from trying to get graphs in journal articles, bar charts are really the way to go. Like it's something that folks are familiar with, and there's something to be said about the familiarity of something. And that goes back to those perceptual tasks and how we remember things. So when we see things in a familiar format, we're more likely to understand and take it in than we see it in an unfamiliar format. Because when it's unfamiliar, we're trying to figure out what the heck is going on here. And that really may be the case for folks like preference to bars over the dot graph. But for me, I see the dot graph, and if you look at the very first pairing, they're so close together, and then you look at the one at the end and they're so far apart. Like to me, that tells the story. And you can see that in the bars as well, but I just find with the white space, it's a little easier to see. So it's really interesting to see how different folks, and sometimes it's also discipline specific. So certain disciplines tend to present things in certain ways, and other disciplines to present it in other ways. So there really is no right answer. You have to play to the audience. Okay, so my button stuck there for a moment. So I'm going to look at another data visualization. This is also from my previous life. These are all coming from this lower extremity amputation. And this time it's not a graph, it's a map, and there's some information plotted on it. And I'd be really curious to hear folks' reaction to this. And again, don't be shy. You will not hurt my feelings.
Just waiting to see if anybody pops in with comments.
Like, well, folks are thinking, I'll say right off the top, looking at this now, I find the numbers on the map are really hard to read, especially in Cape Breton.
Yeah, agreed. I think for me, with my aging eyes, I find the actual images challenging to look at. And Dwayne says it's taking his mind longer to process the information.
Yeah, and Dwayne makes a really great point, because what you're actually doing here is you have to look over at the legend and figure out what all those different things mean. What does the color mean? What does the little square with the H and the person with the amputation? And I have to say, I was really proud of myself for creating that little icon. But it's a lot. And then, like, why is the 41 and the 29 repeated next to Central Zone, and the 19 and 28 repeated next to Cape Breton?
Yes, a few more comments. It feels a bit more busy. It's hard to compare each area. I find it busy and slow to process. And I'm impressed you created an icon.
It's really tedious. There's a lot of work. There's a lot of parts in that little icon, but yeah. So I took that and converted it into what's called a proportion plot. So again, like curious, like How do folks feel about this visualization? It's the exact same data.
We'll give people a second to chime in. A lot easier to read. Interesting. It feels faster to understand. It's definitely more pleasing on the eye. Easier to read, agreed,
100%.
easier to read. Yeah. Consensus is it's much better.
100% agree. So just like there's a few things here. So first of all, the title tells the story. The Eastern Zone residents were disproportionately affected by lower extremity amputation. Like if somebody is looking at your slide, like I heard a stat once that like a busy executive is going to spend 30 seconds looking at your slide and they're not going to look at anything else. So if that, you need to use that 30 seconds wisely. So give them, or as my mentor would say, spit it out. Like tell them what they need to know right in the title. And in this case, the subtitle is used to explain how to read the graph because it is unfamiliar. Not everybody has seen one of these. They're quite popular in newspapers. The format I think was used the first time in like the Washington Post or the New York Times. So that kind of says like if there isn't any different, those lines are going to be the same. Like they're going to be straight. They might be wider or narrower, but they're going to be flat across. So that can be helpful. And then like you can see in the graph that it's very easy to see the Eastern Zone is higher on the, I have to look at my fingers, the left side than on the right side, right? So they've got more amputations than they have population if you turn everything into a percentage. And then as somebody pointed out, the whole slide flows. Like your eyes aren't bouncing back and forth across the slide to figure out what's going on. And then that Eastern Zone color is used in the title. It's used to draw attention to the Eastern Zone numbers on the graph. And then just the little map is there just to help people situate where those are in the province if they're not familiar. So here's an example that I took from the IPAC tool. And I just want to preference this. I think this tool is great. There is a lot of automation in there, and I had a lot of fun playing with it. But I'd be curious to see what folks think about. So this is the graph, and I just put in a bunch of junk data, so it probably makes zero sense. I just wanted to see what the graph would look like, and I'd be curious to see folks' reaction to this. Like, are there things that are easy about it to interpret? Are there things that are more difficult?
For me, it's certainly a familiar presentation of information, but I don't think that makes it the best presentation. So I'm familiar with where to look for what I need to know, but I'm guessing there's a better way. And in the comments, your first impression is that there was a problem in March.
Yes.
Yeah.
I intentionally created that problem. I love that.
I don't love the colors. It's very busy. Hard to read. You have to keep looking to see what the colors are. Too busy. It's familiar, but not a great graph to read. I find it very busy and hard to read. Yep. Some guessing on the numbers. Difficult to compare each section. Too much info in one graph. Hard to break apart. The type of infection. Need a bigger legend with colors. Agreed. Pretty, but not functional. If you're only looking to communicate one message, the problem in March is fine, but if you want to communicate more, it's too much in one space.
Yeah, those are all fantastic comments. And the only thing that I noticed that hasn't been mentioned is the grid itself. I find really distracting. Like the vertical grid lines are really not necessary. And I did bump the width of the graph up. It's a little bit more narrow so I did make a couple customizations as I was working with it. So I converted the same data into what's called small multiples. So you create tiny little graphs, and you can use the same color or you can use different colors depending. Um, Generally, once you hit 4 to 5 colors, it gets difficult to find the 6th different color and the 7th different color. So in that case, you're better off to just use one color across all the graphs and just let your titles tell people what they are. So any thoughts for folks about using a small multiple instead of one big graph?
Yes, much better with small multiple. Like this better. March was a rough month. Easier to understand, much better, simpler, which makes it better. Overall consensus, this is a much better way to present it. It's certainly more pleasing. Can further highlight hotspots much better. Like the separations, definitely better.
Yeah.
It's a
So
win.
a little bit excellent. So a little bit. So in this example, the axis is the same for all graphs, so that the graphs are comparable one to the other. But I actually pulled the axis off because it's hard, as somebody pointed out, like it's hard to judge, right? Like you're like, oh, is that like 42 or 43? I don't know. So if you put the data labels on top of the bars, you don't need the axis anymore because you know exactly how many people or infections or whatever are represented by the bars. And depending on these are little short bars. There was lots of ones and twos, but depending on the type of bar, sometimes you can put the number in the end of the bar if they're all of a sufficient height, and then you can make the number white, or and it just sort of takes down the busyness even a little bit more when you tuck the number in. But these are really simple, tidy graphs, so having that number above the bar is perfectly fine. The other way you can represent this is you can turn them on the side. So these are technically column charts, though I'll call them bar charts all the time. Columns are the up and down, and bar are the horizontals, but you can flip it on its side and do it that way as well. It depends on what kind of space you're trying to fill. So I just want to look at one more aspect of reading graphs, and it's color vision perception. So we just talked about like 5 colors, 8 colors. So to be as accessible as possible, some color palettes need to be avoided. And the one that really needs to be avoided the most is probably the most ubiquitous, especially in the healthcare environment. The traffic light pattern is not visible to 4.5% of the population. These folks have a type of color vision deficiency where they have a reduced sensitivity to green light. Some folks, it's a lesser percentage, have a reduced sensitivity to red light, and the end result is similar. But the green light one is the most common. So they really have difficulty distinguishing between reds and greens and browns and oranges. And my brother has this type of color vision deficiency, and we found out, he's a fair bit older than I am, and we found out when he was helping me color one day, and he colored the top of the tree brown, and I'm like, what are you doing? So if you have that reduced sensitivity to green light, this is what the traffic light will look like. So you can kind of discern the red is different from the yellow and the green, but the yellow and the green look identical. But there are tools. One that I use a lot is called Color Brewer, and it's kind of funny because it's a tool for mapping. So when my husband saw me using it, he's like, "What are you using Color Brewer for?" And I'm like, "So that I can pick a palette that is appropriate for people with color vision deficiencies. And there's 6 palettes that are appropriate. This is a sample of 4 of them. The other is kind of a teal brown scale and a purple orange scale. But the ones that I tend to use the most are the red blue and the orange blue. And it depends on context, because color is also emotionally laden. So sometimes I avoid using the red palette because it may inadvertently convey a strong emotional meaning that I don't intend. So if you're reporting infection rates and you use red, people are going to be alarmed because red is that, oh, stop, or red is that, oh, something's like really bad is going to happen. So people will react strongly to it. So in those cases, I tend to use orange as that color. And these swatches will show like just samples of the these palettes. I tend to put them in a swatch like this just so I can put it through a color vision deficiency simulator, and the web address to the one I use is there on the slide. So you can see that for the red green color vision deficiency, the palette is fine. You can see all the colors. There's 4 distinct colors. And there's also a color vision deficiency called a chromatopsia. And folks that have this only see in gray tones. And so in that case, saturation then becomes important. So in these particular color palettes, it's the exact same saturation at the extremes of the palette. So the darkest purple and the darkest green in grayscale will look identical. So you just need to off shift by 1 to get your 4 distinct colors.
Pam, I'm sorry to interrupt, but we've got about 4 minutes before we have
Oh,
to leave.
okay. Sure. I think I'm very close to the end. So yeah, so here is that graph I promised. This is the one from my previous life. So this is a nested donut graph, so created before Excel had that capacity. So again, I was super proud of this. But in looking at it now, the yellow and the orange aren't very different, and it's really hard to compare the 2 orange slices because they're not lined up. The green text on the red, my brother would not be able to read that. The white text on the yellow is not appropriate for folks that have low vision. There's no way they'd be able to see that. The Again, kind of like that map, the text is all over the place, and the light and blue and the light green is disconnected from the green that's used to emphasize points. So there's a lot going on there. So I converted that same data into a back-to-back bar chart.
Wow, that is a huge, huge difference. I think that everybody will be able to agree that so much clearer and visually pleasing.
Yeah, so again, like the story, the text is all over the place, and now the story is right there. LEA admissions among people with diabetes are most often at the level of the ankle and the toe. And this actually speaks to that apples and oranges issue, that if you have diabetes and you're having an amputation, it's because of loss of circulation, and it starts at the toes and works its way up. If you don't have diabetes and you're having an amputation, chances are it was cancer or an injury. And those are very different amputations. So very different populations. But the flow works better. As Angela said, the colors are more pleasing. The colors are great from a color vision deficiency standpoint. And just like on that surveillance tool section we ended with people, I just want to end the data viz section as well with people. So I read a quote in a book called Storytelling with Data that really has stuck with me. And it was Laszlo Bock, who worked for Google at the time, said that having all the information in the world at our fingertips does not make it easier to communicate. It makes it harder. The more information you're dealing with, the more difficult it is to filter down to the most important bits. So great data viz needs to be adapted to the audience and to the purpose. And you need to get to the bits that are important for your audience. And the information needs for senior leaders is going to be different than those for frontline staff. Information for increasing awareness is very different than information that you might use to start a conversation or to talk to experts to gain additional insights. A graph that EPIs share amongst themselves is going to be very different than one that we would share on a public-facing website. So I'm a data person, data geek, so I tend to overcomplicate things. So I always need to be cognizant of my audience, and sometimes I'm successful and sometimes I'm not. So if folks don't understand a graph or a visualization, I know I've missed the mark. It doesn't mean the graph is bad. It just means it wasn't the right graph for that audience. So just, in summary, to recap, things to keep in mind is, again, like, know your audience, use your graphs. They're an efficient way to convey a lot of information. Make sure you have a great title. Use plain language, no jargon or abbreviations, especially across disciplines. Sometimes those get lost. Keep it simple. So there's nothing wrong with bar and column charts, line graphs, dot graphs. They're perfectly fine. And then be mindful of accessibility issues. So try and be mindful when you choose colors and fonts and make use of negative space. And that's everything. So thank you. And
Thank you so much, Pam. That was fantastic. I think my biggest takeaways are garbage in, garbage out. I'm going to be working on some great data viz, and that 3D is bad. I'm certain I'm guilty of going, ooh, I could make this 3D. So I will retain that important tidbit of information. Lots of amazing sessions. Thank you, thank you, thank you coming in through the chat. We do not have a ton of time for questions, but Pam, would it be okay if folks have outstanding questions, they could email them to us and we could forward them on to you?
yeah, absolutely. Absolutely.
Perfect.
And anybody that has like a data viz question, feel free to send those along. I'm happy to answer them if I can, or point you to a
Perfect.
resource that will be helpful.
Oh, perfect. Perfect. Thank you so much.
You're
And for
very
everybody
welcome.
else, our next session is starting momentarily. Don't forget to leave this session and head over to the other one. Thanks again, Pam. That was fantastic.
Thanks, everybody. Bye-bye.